So, in the earlier class, we were discussing about the adrenergic receptors, different subtypes, and different interactions. And in this class, we are going to learn the details about the adrenergic receptor and their agonists and antagonists. Especially now, we are coming to the drugs actually, which are affecting the adrenergic nervous system and therapeutically, which are important for as a pharmacologist to you for the treatment of various disorders in cattle are concerned. Not only cattle but also human beings and other animals. How we can depart our knowledge of the autonomic pharmacology to the practicals. So, adrenergic drugs are also known as the sympathomimetic drugs. Sympathomimetic drugs because they are going to mime the sympathetic action, and it is classified as the drugs which are acting on the sympathetic nervous system are classified as direct sympathomimetics, indirect sympathomimetics, and mixed action sympathomimetics. So into three classifications we are going to do here, whereas the direct sympathomimetics means they act directly as agonists on please alpha and beta. Whenever there is A and B, please see that there are alpha and beta adrenal receptors. Whereas the adrenaline, noradrenaline, and isoprenaline are isoproterenol and phenylephrine, methoxamine, xylometazoline, salbutamol, and many others are the examples for the direct acting sympathomimetic drugs. So please note down some of the important drugs. Adrenaline itself and noradrenaline, they are the specific agonists at the receptor level, and isoprenaline or isoproterenol, phenylephrine, methoxamine, and xylometazoline, salbutamol, and many other drugs are acting as the direct sympathomimetics, whereas the indirect sympathomimetics, so they act on adrenergic neuron to release norepinephrine, which then acts on the adrenal receptor. So they release or deplete the adrenergic neurons, and the norepinephrine is released indirectly directly by tyramine and amphetamine. Actually, amphetamine is a drug which is used for doping, and mixed action sympathomimetic they act directly as well as indirectly. Example is ephedrine, dopamine, and mephentermine. Ephedrine, dopamine, and mephentermine, they are the mixed action. They act directly and indirectly. Both places they are going to act. Direct acting means they are going to act on the postsynaptic receptors directly, and indirect acting they are going to release the norepinephrine from the releasing site, and they are going to make it to bind with that of the receptors. And mixed action they are going to do the both, means they are directly acting on the receptor and also indirectly they are going to release the norepinephrine from nerve ending. The drug is ephedrine, is a bronchodilator, whereas the dopamine, a neurotransmitter, and mephentermine is another drug. So please remember all these drugs as a prototype of the each class so that you can remember it for the academic purpose. Then, what is the action of these drugs on the peripheral system? Example, the peripheral actions of the adrenaline in most tissues have been very clearly differentiated into those medicated by alpha or mediated by alpha or beta receptors depending on predominant receptor present in the given tissue. So what you can see is in a particular given tissue, there should be either excitatory or inhibitory type of the action, and all these actions are mediated by alpha or beta receptor. Alpha receptors are classified as alpha 1, alpha 2, alpha 3, etc. And beta receptors are alpha 1 and alpha 2. Beta receptors are beta 1, beta 2, and beta 3. Alpha 1 once again, alpha 1A, alpha 1B, and alpha 1D, whereas the alpha 2 is determined into 3 or 4 type of the receptor, alpha 2A, B, C, and D. So you should know these classifications. So there are varieties of the receptor subtypes. Wherever it's defined has been mentioned in the parenthesis, means in the bracket. The actions of the particular sympathomimeticamin depend upon its relative activity as different type of the adrenergic receptors. For example, the alpha 1 is active against alpha 1 but also alpha 2, beta 1 and beta 2, whereas it has got a weak action on beta 3 type of the receptors, whereas noradrenaline is having all the actions but it has not do not have any action on the beta type of the receptor. So if you know this very well, then you can predict the action on individual tissues very specifically, whereas the isoproterenol is very acting on the highly active on beta 1, beta 2, beta 3, both all the three receptors, but no action especially on the other type of the receptors, especially on alpha type of the receptors. It's very specific beta type of the receptor stimulant. So coming to the individual action of the adrenaline, especially where it's acting. Suppose no other drug is acting and you have exogenously administered adrenaline, then what happens on the heart? So here the adrenaline increases the heart rate by increasing the slope of slow diastolic depolarization of the cells in sinoatrial node or SA node. So then it activates the latent pacemakers of AV node and Purkinje fibers. Arrhythmias can occur with high doses of the adrenaline and the BP is marked very highly. So the action of the adrenaline you should know so that you can predict the other drugs action which are very similarly acting like norepinephrine or adrenaline. And force of cardiac contraction is totally increased by how it is increased by the development of tension as well as relaxation which are accelerated. So that's why the force of the contraction is increased. The systole is shortened more than diastole. So contraction and the force are increased. The cardiac output and oxygen consumption of a heart are markedly they are enhanced because whenever there is a cardiac rate is increased, the force of contraction is increased, then it requires more oxygen and also more glucose. So the conduction velocity is increased, means in one stretch what we can say is all the activity of the heart will be increased, especially from the action of the adrenaline on the beta 1 type of the receptors. So beta 1 type of the receptors. So another thing is the quiescent period or refractory period of all types of the cardiac cell is drastically it is reduced, and all cardiac actions are mainly or predominantly mediated by beta 1 type of the receptor, as you know very well. Beta 1 is highly abundant in cardiac tissue, especially SA node, AV node, here for his Purkinje cells and the myometrium of the heart. And what happens if the adrenaline you are given directly and also the endogenous release of the adrenaline or norepinephrine. So what happens is there will be both vasoconstriction and vasodilatation, whereas the vasoconstriction occurs due to the alpha 1 type of the receptor, whereas the vasodilatation occurs due to the beta 2 type of the receptors depending upon the drug, its dose and the vascular bed. And the constriction predominates in cutaneous. Once again, in every vessels a little bit it's once again complicated because in sometimes the constriction is dominated, whereas in some places the vasodilatation is dominant, and constriction predominates in cutaneous and mucous membranes and renal beds. So whenever you have administered the drug adrenaline directly to the animal, maybe any route, IV or any other route, constriction usually predominates in the cutaneous blood vessels, and especially the mucous membranes of the eye. Wherever you can see the visible mucous membranes and renal bloods, everywhere it is going to constrict the blood vessel, means the blood supply to the said organ is decreased, and vasoconstrictions occur through both alpha 1 and alpha 2 type of the receptors. So alpha 1 is postsynaptic and alpha 2 is presynaptic, which as presynaptic it's inhibitory in nature, postsynaptic it's excitatory in nature. However, location of A2, it is extrajunctional receptor, is that they are going to activated only by circulating catecholamines, whereas alpha 1 it is junctional receptor, primarily mediate response to neurally released norepinephrine. Here once again there is little bit tricky thing. The vasoconstriction, how it's going to occur is by uh, both activation of the alpha 2 type of the receptor and alpha 1, but the location of this alpha 2 is not always presynaptic, it is extrajunctional, means other junctions, so that they are activated only by the circulating CAs, because in the synaptic cleft the noradrenaline is secreted and it can only act on the postsynaptic receptors, and the receptor primarily mediate the response, especially alpha 1 and alpha 2. What happens? So dilatation mediates in the skeletal muscles. In the many of the smooth muscles, constriction occur, whereas in case of dilatation in skeletal muscles, liver and coronary bed. So coronary, especially in case of, that means more and more blood is required during the flight or fight reflex, and less blood should be supplied to the other organ. That's why this type of mechanism is present. The direct effect of cerebral vessels is not prominent, and blood flow through these bed cells changes the blood pressure. So it's a beauty of the body, that how it is going to conserve the energy, and it is going to restrict and control the blood supply to the different organs during the fight or flight reflex. See, especially adrenaline is released during fight or flight reflex. Lot of adrenaline is poured into the circulation during the fight or flight reflex, as you know it very well, and the action is more marked in arterioles, small arteries, and capillaries and pulmonary sphincters, larger arteries and veins are affected at the higher dose only, means not the endogenous dose. If you exogenously administer in higher dose, then all these other vascular beds are affected, whereas the cutaneous, mucous membrane and renal, the arteries are going to constrict, whereas in the muscle, skeletal muscles, liver and coronaries, it is dilated and lot of blood is gushed inside these organs. These are two important things to learn the action on the blood vessels. Then what happens to the blood pressure whenever the adrenaline is injected to the animal exogenously, or lot of adrenaline is released during the fight or flight reflex? So the effect, it depends upon the amine, its dose, its rate of administration. Especially noradrenaline causes the rise of systolic and diastolic pressure, means BP, diastolic, systolic, both diastolic. That's 60 and that's the 80 and 120 is there, both are increased. It is diastolic, 120 is systolic, both are increased, whereas it is not going to cause the vasodilatation, because if vasodilatation is there, then the blood pressure will be decreased. That's why it is not going to act on the beta 2 type of the receptor. Only since it is going to increase the heart rate, increase the force of contraction, it is called as the, then because of this thing the blood pressure increases. Whereas the another drug isopronoline, it is very specific to beta type of the receptor, so it causes rise in the systolic but marked fall in the diastolic activity because of the beta 1 cardiac stimulation, whereas it acts on the beta 2, causes vasodilatation. So what happens, initially there will be increased in BP, later it's going to relax or down. The mean BP generally falls. That's why the summation of effect of the isopronoline is the decrease in BP. So it's very interesting to know that if you administer the drug in small quantity, it is going to increase the BP, or if you increase it little bit, it is going to act on the beta 2 type of the receptor, peripheral vasodilatation occurs, and the BP will be decreased. See, it's a very wonderful thing that especially the blood pressure of a human being or the animal is controlled by the adrenergic system in a very systematic way. Then adrenaline given by the IV or exogenously or subcutaneous injection cause rise in systolic pressure, but diastolic pressure decreases. Especially atrial contraction becomes down, whereas the ventricular contraction become more. Mean BP generally rise adrenaline if you give. Pulse pressure is increased, and rapid IV injection of adrenaline. If you given the slow IV, then there is a response. In fast IV, there is different response. How much interesting this is? The rapid IV injection of adrenaline, it produces a marked increase in the both systolic as well as diastolic BP. Whereas if you administer slow IV, then there is a systolic blood pressure will be increased, whereas the diastolic blood pressure will be decreased, because the action is different on the beta type of the receptor, beta 1 type of the receptor, and beta 2. And this mechanism is a rapid uptake of the dissipation of adrenaline concentration around the receptor is reduced, and low concentrations are not able to do the action on the receptor but continue on beta receptor. So what happens is, initially they are going to, the affinity of the beta 1 receptor will be more, and they are going to, most of the noradrenaline is going to occupy the receptor, and later then the other beta 2 type of the receptors are going to act, and ultimately it's causing peripheral vasodilatation and the blood pressure becomes down. When a blocker has given, only the fall in the BP is seen, and because of the Dale's reversal phenomenon. So what's a Dale's reversal phenomenon? You are going to inject the noradrenaline or its agonist, then there is increase in the blood pressure, and if you inject the beta adrenergic blocker, then it is going to decrease the blood pressure. This is known as the vasomotor reversal of Sir Henry Dale, or Dale's reversible phenomena. And this Dale's reversal phenomena is a very frequently asked question, and please remember this thing. Especially the Dale's reversal phenomena is very much related to heart. When the adrenaline is given or a agonist is given, there is increase in the blood pressure, whereas antagonist is there, then it is going to nullify the action of the agonist, and the blood pressure is going to decrease, means it is reversed. That's why it is known as Dale's reversal phenomena. And on the lungs, what happens? So it's very interesting to know that adrenaline, isopronoline, but not norepinephrine, among just the adrenaline is one methyl molecule is more, and it does so many different actions, whereas the noradrenaline contains one less methyl molecule. Phenylethylamine N-methyl transferase is the one which donates one methyl molecule to the noradrenaline, then it is converted to adrenaline. So the adrenaline and isopronoline, but not norepinephrine, are potent bronchodilators. So adrenaline and isopronoline are potent bronchodilators, whereas the noradrenaline is not. So this action is also marked when bronchi are constricted. So in case of asthma, there is bronchoconstriction, whereas at that time you can administer adrenaline and isopronoline. But please seek that there will be increased blood pressure also. At that time you should see that force of the myocardial pumping, and also the rate of the heart will be increased. So whenever if you take care of one organ, then there is a change in the other organ because the total receptor subtype is totally different from that of the heart and bronchiole. So you have understood. So adrenaline is given by aerosol, additionally decongest bronchial mucosa and action. So if you are an asthmatic patient, then you can understand this very well because you are suffering from that particular disease, and some of the time, many times, the sprays like salbutamol, albuterol, and ephedrine. So all these are given. If the spray is given inside the mouth, which enters the trachea and acts on the beta 2 type of the receptors, and it is going to relax the bronchi, and immediately you will feel relaxed, whereas your heart rate is going to be increased and blood pressure is going to be increased. That's the side effect which is not required, but anything which is called as a drug will with effect will have a side effect. One thing I will tell, any drug which is having effect will have a side effect because we cannot make the drug to go directly to a receptor on a particular organ and act, whereas it will circulate throughout the body, and wherever the receptors are there, it is going to do the action. That's the unwanted action also. That's why the any drug which is having effect will have a side effect, and any drug which is not having side effect will not be a drug at all. So please remember, sometimes the homeopathy and many drugs, they are claimed as the very good drugs and say that they do not have side effects. Means if a drug is not having any side effect, then it is not having any effect, and the action may be due to the placebo effect. And adrenaline can directly stimulate respiratory center, but this action is seldom manifest at clinically used doses. And what happens in the rapid IV injection, already we have seen that causes transient apnea, especially it is going to cause transient increase in the blood pressure and transient apnea due to reflex inhibition of respiratory center. So one should be careful, and toxic dose of adrenaline cause pulmonary edema by shifting blood from systemic to pulmonary circuit. So if you administer more and more quantity of the adrenaline, so then what happens, there will be formation of pulmonary edema because lot of blood will be flow to the pulmonary arteries and capillaries, and there is a fluid oozing will be present in the lungs, and this is known as the pulmonary edema. So the eye, what happens if you administer the particularly the adrenaline, or suppose in a flight or fight reflex, when the animal suddenly faces some situation which is unwanted for it, then mydriasis occur, means pupillary dilatation occurs due to the contraction of the radial muscle of the iris, that is due to the alpha 1 type of the stimulation, but this minimal after the topical application because the adrenaline penetrates the cornea poorly. So to accommodate the light and the situation, to see the especially things very clearly, whenever you are frightened, there is dilatation of due to the contraction of radial muscles of the iris, dilatation of the iris pupil, and this is called as the mydriasis. But this minimal effect after the topical application. If it is locally given, then it is not going to cause such action because adrenaline penetrates cornea very poorly. That's what we say, and science has proved it. The intraocular tension or the pressure tends to fall, especially in the wide angle glaucoma. And glaucoma is the one which is accumulation of the ocular fluid in the body. There are varieties of this glaucoma, wide angle glaucoma and short angle glaucoma, etc. So intraocular pressure tension tends to fall, especially in the wide angle glaucoma. And adrenaline has complex effect on the aqueous humor dynamics, especially the aqueous humor and overall aquification of the formation is reduced and outflow is facilitated. That means it is having a specific and marked effect on the eye. First of all, it's going to cause the mydriasis, then intraocular tension increases, falls, and also the aqueous humor will have some effect. So the formation of aqueous humor will be seen. And of course, it is having many other effects apart from this particular thing. So, the gastrointestinal tract, one of the important tissues in the body that we need to learn is what is the effect of the adrenaline on the gastrointestinal tract. So, what happens? Just imagine that when you are in a fear, lot of fear, and about to run, then what will be the effect of adrenaline on your gut? So, in case of isolated preparations, relaxation occurs through the activation of both alpha and beta receptors, whereas in case of the intact animals like us and man, the peristalsis is reduced. Peristalsis is reduced and sphincters are constricted, but the effects are brief and no clinical importance. So, whenever you are in a very hurry, then the intestinal peristalsis will be decreased, whereas sphincters are constricted. Please watch this in future. And the bladder detrusor is relaxed and trigone is constricted due to the alpha action. The detrusor muscles, I think you know very well about the detrusor and trigone muscles, as this time as you already undergone the anatomy classes. So both actions tend to hinder micturition. So whenever you are in what you call as tension or anxiety, then the micturition will be hindered, or it is drop by drop that you might have so many times. The animals might have also experienced, because if you go to the cattle shed of a farmer and if there is a buffalo, the buffaloes are very much animals with very much anxiety. So a veterinarian goes means they will be frequently micturating, because here the trigone muscle will be relaxed, and because of this thing the micturation occurs and the constriction it stops. So there will be frequent micturation, and the uterus adrenaline can both contract and relax uterine muscles respectively through alpha and beta receptors. That's why many times the pregnant animal should not be disturbed. Otherwise, it is going to cause the contraction and later relaxation, because the uterus has got both alpha and beta type of the receptor. And terbutaline, or the beta 2 adrenergic specific receptor antagonist, is the one, a drug administered whenever there is a threatened abortion. This is the basis for the particular thing. Overall effect varies with species, hormonal and gestational status. So many things are there. But the splenic capsules, it contracts due to the alpha action, and more RBCs are poured into the circulation, more and more RBCs, because more and more RBCs are required for the increased circulation whenever there is a fight or fight reflex. Then the skeletal muscles. So usually the skeletal muscles neurohumoral transmission is facilitated. In contrast to the action of the autonomic nerve endings, the receptor activation on motor nerve endings augments acetylcholine release, probably because of its alpha 1 subtype. The subtype of the receptors especially present on the alpha, this skeletal muscle, is the alpha 1 type of the receptor, and is going to increase the release of the acetylcholine release. And the direct effect on the muscle fiber of the adrenaline is exerted through the beta 2 type of receptors and differs according to the type of the fiber, which type of the skeletal muscle fiber. The active state is abbreviated that less tension is developed in slow contracting red fibers. Once again, there are red fibers and the other type of the fibers are present in the skeletal muscles. The action on rapidly contracting white fibers is too prolonged, the active state and increase the tension developed. So this is one of the important action. Means the overall action, especially in the skeletal muscle, is it is going to contract and the tension develop, means strength of the muscle, especially for fight and flight reflex. It should be, the animal should be ready with more and more muscle strength. That's why it is made as the tension is increased in the muscle and more blood flow will be there. As we have seen that the capillaries supplying to the skeletal muscles are relaxed and more blood will come. And in the central nervous system, so please remember that whenever the adrenaline is clinically used, if you administer the adrenaline, which is available in the ampoules, especially it is a life-saving drug and does not produce any marked CNS effects because it is not going to penetrate into the blood-brain barrier, but restlessness, apprehension, and tremor may occur because of the partial cross of that adrenaline through the blood-brain barrier. As a catecholamine, it is not going to pass. The exogenously administered adrenaline is not going to pass the blood-brain barrier, whereas the endogenously, definitely there is action is there. The activation of alpha 2 type of the receptors in the brainstem by selective alpha 2 agonists results in decreased sympathetic outflow, and also the BP will be fall and the bradycardia will be seen. Activation of the alpha 2 type of the receptors, especially in the. So please see here that the heart is controlled by many type of the controls. Number one is the adrenergic receptors, beta, it's mediated by beta 2 type of the receptors, where the force and the duration of the contraction is going to increase, whereas due to the cholinergic action, it is going to relax. And apart from this direct action, the central nervous system also controls the heart through the what you call as the cholinergic nervous system. And the metabolic effect is adrenaline causes the glycogenolysis and hyperglycemia, hyper what is called as the hyperlactacidemia and lipolysis, rise in plasma free fatty acid or FFA, and its calorigenesis is more because of the action on beta 2 and beta 3 type of the receptor. So ultimately the metabolism need to be increased to cope up with the situation of fight and flight. That's why the catabolism of the glucose and also uh, hyperglycemia occurs, catabolism of the fat and other tissues, and pouring up of the what do you call as the glucose from the liver will occur, and ultimately hyperglycemia will be seen. There are These are due to the direct action on the liver, muscle, and adipose tissues, as I already told. So, the depot of the glucose are present in liver, in the muscle, and in the adipose tissues. The first one is the liver, then on the muscle and adipose tissues. So, these are the one which are going to release the glucose into the blood whenever there is a fight or flight reflex, and transient hyperkalemia followed by hypokalemia occurs due to the initial phase of the potassium from the liver, and later it is enhanced uptake into the skeletal muscles as well as in the liver. That's how it takes place. And adverse effect and contraindications of the adrenaline, then whenever you administer the adrenaline to a patient to whose heart rate is normal or who is suffering from the shock, then there will be transient restlessness, there will be headache, there will be palpitation, there will be anxiety, then tumor, tremor, and pallor may occur after subcutaneous or IM injection of the adrenaline. So due to the varieties of the actions and the headache and other thing, the exact mechanism is not known. And marked rise in the BP leading to the cerebral hemorrhage. So whenever due to the action of the adrenaline on the beta 2, beta 1 type of the receptors on the heart, there is marked increase in the BP, and this causes cerebral hemorrhages, ventricular tachycardia, fibrillation, angina, means there is a pain in the heart if more and more this is given adrenaline, then myocardial infarction or hazards of large doses of the inadvertent IV injection of adrenaline. So adrenaline should not be repeatedly given administered to the animals so that it causes certain adverse effects on the heart. Adrenaline is contraindicated in hypertensive, hyperthyroid and angina patients, because in case of angina patients, so there will be already there is what you call as the pain, cardiac pain will be there. Then at that time the adrenaline will increase it more, and also hypertension means already the blood pressure is more. So such patients the blood pressure will increase more and more, and there is a chance of the cardiac failure. And adrenaline should not be given during anesthesia with halothane. Please see that. So adrenaline is a very common practice that during the anesthesia and other things, adrenaline is given. So it should not be given in case of halothane anesthesia, and because it causes risk of arrhythmia, and to patients receiving beta blockers, especially the adrenaline should not be given during anesthesia and halothane, and to the patients giving the beta blockers, especially beta 1 blocker, which causes, because of this thing, it causes marked rise in the BP, and which can occur due to the unopposed action of the adrenaline. That's how one has to be very careful while administering the drug. And the classification of adrenergic drugs, please remember this very particularly, and you have to mug up all these drugs. That's compulsory, because many times it's therapeutic, this exam point, it's very important to remember therapeutic classification of the adrenergic drugs. So the number one is the pressor agents, means which are the drugs going to increase the blood pressure. They are known as the pressor agents. So here remember the drug is noradrenaline, phenylephrine, ephedrine, methoxamine, dopamine and mephenteramine. Same like directly acting drugs. Whereas the cardiac stimulants, and very specifically whenever there is a problem of the heart, and if the animal is in the shock, these drugs can be given like adrenaline, dopamine and isopronoline. They are very specific to cardiac, especially isopronoline is very specific to beta 1 type of the receptors. And the bronchodilator, of course, the isopronoline, which is also going to heart, action on the heart, and also the salmeterol, salmeterol, formoterol, or it's also known as albuterol. So in most of the bronchodilators, these are all the drugs: salbutamol, that's albuterol, and bambuterol, and terbutaline, or it's available in the bricanil, and it's very specifically used in asthma patients, terbutaline, because it's a very specific bronchodilator. Of course, it's also going to act on the heart, especially a heart, and causes certain problems. And so there are certain agents which are very specifically used as the nasal decongestants. So if you see the drugs which are having the nasal decongestant property, the drugs will be containing phenylephrine, nefazolin, xylometazoline, pseudoephedrine, oxymetazoline and phenylpropanolamine. So you can make certain codes to this thing, and remember P, N, X, P, O or P, like that. You can make your own code to remember, but it's very important to remember every time. And the CNS stimulants like amphetamine, dexamphetamine and methamphetamine. Amphetamine is also used as a drug to dope the horses. So it is a CNS stimulant, especially these are going to cross the blood-brain barrier and act on the receptors in the brain and cause the stimulation. Whereas the anorectics, the examples are phenfluramine, then sibutramine, and another example is dexaphenfluramine. So these are the anorectics. Whereas the uterine relaxant and vasodilators, many times few of the drugs name repeats like the salbutamol, terbutaline, isopronoline, which is a very specific drug, and Adrenergic. So these are the drugs which are the uterine relaxant and vasodilators. So you cannot have especially the drug acting on sympathetic nervous system very specifically, because there are varieties of the receptors, and even though the receptors having one type of the action in one tissue, it would be exerting different type of the action in the different tissues. That's why highly unpredictable action is seen. That's why whenever you are using the adrenergic drugs, you should be careful that it should not have the adverse effect on the other organs. And next is the another important drug or neurotransmitter. It's the dopamine. So this dopamine is a dopaminergic, means it is trophic towards dopamine 1 and dopamine 2, and also the adrenergic alpha 1 and beta, alpha and beta 1 type of receptor, but not beta 2. It is effective. That means the dopamine is not going to cause any action on the trachea, whereas it has got many actions on the beta 1 type of the tissues, especially heart. So now we can know that so many controls are there on the heart. So the dopa 1 type of the receptors, then the dopa type of the receptors, especially they are active on the dopamine 1 type of the receptor, and mesenteric vessels are the most sensitive, and IV infusion of low dose of dopamine dilates these vessels. There is a small difference between one carboxyl group or some hydroxyl group change in case of the dopamine and norepinephrine, but it makes a lot of difference. So it increases the glomerular filtration rate, especially in case of the kidney, and in addition, dopamine causes natriuretic effect by dopamine receptors on the proximal convoluted tubule of the kidney. The next drug is the dopamine. So here we are not going to tell you about the dose, etc. So it's very difficult to remember. At least you have to remember the name of the drug, because the dose, the route of administration, the quantity need to be administered at different intervals. All these will make you to a complicated thing to learn. So please remember at least the titles of the drug here. Suppose if it's a dopamine, then we have given only 2 or 3 sentences so that it becomes easy for you to remember. But at the same time, you should not miss the subject at least to the minimum extent. And the next drug is the dopamine. What's a dopamine? A derivative of dopamine, but not a dopamine 1 or dopamine receptor agonist. And though it is acts on the both alpha and beta adrenergic receptor, it's because it is structurally similar to that of the noradrenaline and adrenaline. The only prominent action of clinically employed is increased force of the cardiac contraction and output without significant change in the heart rate and peripheral resistance and blood pressure. So dopamine is a specific drug at D2 type of the receptors. As such, it is considered to be a relatively selective beta 1 agonist, means it is going to act on the heart, and it is used as an inotropic agent in pump failure, especially in case of accompanying myocardial infarction, cardiac surgery, and for short-term management of severe CHF, congestive heart failure. Usually, congestive heart failure will be what you call LAS will be treated with a high ceiling diuretic followed by a beta adrenergic agonist, beta 1 specific vitamin adrenergic agonist, so that the pressure on the heart is reduced. And ephedrine is a very specific bronchodilator which is going to act on the beta 2 type of the receptors, and it is an alkaloid. Ephedrine, amphetamine and tyramine, all these are the among these the ephedrine is an alkaloid obtained from the plant Ephedra vulgaris. Please remember this, it is plant originated, and nowadays the synthetic drugs are also available. Ephedra vulgaris, and mainly acts indirectly, but some direct action as well as the both receptors alpha and beta receptors. So it is also 100 times less potent than adrenaline, even though it's not so potent than adrenaline, but its action is long lasting 4 to 6 hours, whereas the action of the adrenaline is very short, maybe 1 or 2 minutes. It's very short, and its metabolism is taking very fast, not fast as the acetylcholine, but it's fast. And amphetamines like ephedrine, amphetamine, etc., all these are commonly used for the purpose of bronchodilation. And amphetamine, these are synthetic compounds having the pharmacological profile very similar to that of the ephedrine, because ephedrine is a very specific bronchodilator. So amphetamine is also used as a bronchodilator. Of course, they exert potent CNS stimulant and weaker peripheral cardiovascular action. That's why it is used as a doping agent, amphetamine. So the performance of the animals or the athletes will be increased if the amphetamine is taken. So because it has got potent CNS stimulant effect, and the central action of the amphetamines are largely mediated by release of norepinephrine from adrenergic neurons in the brain. So it is not going to act directly on the receptors, but it is going to release norepinephrine from the adrenergic neuron in the brain, whereas it inhibits the neuronal response, neuronal reuptake of the. So it inhibits the neuronal reuptake, means uptake 1, which is from the peripheral liquid or peripheral tissue to the inside the exoplasm. Then once again uptake 2 is uptaking of the adrenaline from the cytoplasm to the vesicular storage site, and this inhibit the uptake of the DEA or dopamine. And amphetamines are the drug of abuse, so that's why they are the abusive drug and are capable of producing marked psychological but little or no physical dependence. So many of the drugs which are having abusive nature, they have the physical dependence, just like your diazepam, etc. They are what you call as, if you given it in therapeutic dose also, the person develops the abusive actions, diazepam, morphine, and all these drugs are abusive drugs. So amphetamine is also sometimes used in the horses to dope them. So one should be careful about the action of these particular drugs. And phenylpropylenamine, or it's also abbreviated as PPA. So this is being chemically pharmacologically similar to ephedrine, means all the actions of the ephedrine, just like it is going to act on the beta 2 type of the receptors in the trachea and going to relax the trachea and dilate the trachea, especially in the asthma situation. So the PPA causes vasoconstriction and has some amphetamine-like CNS effects, including suppression of the hunger. So it is going to pass the blood-brain barrier and going to act on the satiety center or hunger center and reduce the what you call as the hunger. and because of this property it is going to be used in case of the what you call as the anti-obesity drugs. So it is not a proper drug, but this side effect is used as a advantage for the anti-obesity effect. So it was included in the large number of oral cold decongestant combination, because if you go and see any vial or the bottle of the the antitussive drugs, then you can find the ephedrine, phenylpropylenamine is one of the most common ingredient. So please observe this particular content, phenylpropylenamine in the especially the drugs, antitussive drugs and cough syrups, because it need to relax the trachea and cause less irritation, but it's also going to cause the vasoconstriction and has some amphetamine like in case of CNS effect. So you feel some immediately you are cured if you take the antitussive drugs, and it was included in a large number of the decongestants. Immediately it's going to cause nasal decongestion. If you are having the running nose, then this preparation is given, and immediately if you consume the tablet your running nose will stop and you will get relaxed, because the tracheal dilatation occurs and also CNS stimulation occurs, and you may feel better, especially in case of the no nasal decongestant action. And phenylephrine is a specific uh, beta adrenergic agonist. A alpha 1 adrenergic agonist has a negligible beta action. Phenylephrine, there is a alpha 1 adrenergic agonist, a selective or specific alpha 1 agonist. It has very negligible action on beta receptors. So please remember this drug. It raises BP by causing vasoconstriction, because alpha 1 receptors are present on the capillaries, and because it has little cardiac action, then reflex bradycardia is very prominent, and topically it is used as a nasal decongestant, and in the eye producing mydriasis when cyclophagia is not required. Then phenylephrine tends to reduce intraocular pressure by constricting ciliary body of the especially and the blood vessels. So it also a frequent constituent of orally administered nasal decongestant tablets or preparations. Phenylephrine, phenylpropylenamine, and ephedrine. These are the very commonly used antitussive agents and nasal decongestants. Please remember, whenever you see the cough syrup, and you have to remember this particular action. It's going to relax the trachea and cause the airway passage easy, and also it is going to constrict the nasal what you call as the blood vessels, and the what you call as the frequent constitution of orally administered nasal decongestants, especially the running nose is stopped. And in the tomorrow's on Monday's class we will discuss about the selective beta 2 stimulants. And thank you very much for the